Contraindication to the semi-permanent makeup. You must be over 18. You mustn't be pregnant or breastfeed. You must feel well and fit for the procedure. So we really look in very seriously if you have a very strong allergic and allergic to so many things. So we do need to patch test you and patch test you again if you are. So if you have any injectable or fillers in the area to be treated, whether it's eyes and brows, so you need to let these healed before you come for the semi-permanent makeup. So imminent holiday plans, I would say you need to postpone the treatment of semi-permanent makeup if you are going on holidays very quickly. So you better do it after the holidays, as it can affect healing, and in many ways it will bleach color faster, and obviously the sun really bleaches the color. Keloid scarring is a no-no. We can't proceed with semi-permanent makeup if you have keloid scarring. They mostly are based on the torso, but they definitely could stay on the brows or eyeliner or lips if you have a tendency to develop a keloid scarring. If you have epilepsy or seizures in the last 2 years, so we obviously need to make sure to keep your stress level well. Any undiagnosed swelling is a contraindication. Any current infectious disease, hepatitis C, shingles, if you easily have shingles on many occasions and it triggered by literally anything or everything, so obviously we can't proceed with the treatment. If it comes to the lips, a cold sore in the lips, it is very common to have cold sore after semi-permanent makeup on the lips, and I will strongly advise you to contact your doctor and get a prescription for anti-herpes medicine, so the healing will be nice and smooth. Diabetes usually the wound is healing very bad with diabetes, and that's why I would recommend you to get it under control first. Otherwise, the infection could spread easily in the little cuts and little tinted applications, so need to be very careful with that. If you have problem with wound healing, it's a no for semi-permanent makeup. If you take in blood thinners or anti-inflammatories, that's a no. It's very easy to actually create the bleeding, although application is not deep, so there shouldn't be any bleeding, but you could have a thin skin and capillaries could be quite close to the surface of the skin, and we might sort of disturb one or two, and if that starts to bleed, it's not really nice. If you take antabuse, which is obviously alcohol rehab drug, or Roaccutane, if you have treatment acne scars or life acne, so that's a no. It's impossible. You need to wait 6 months after the last tablet before you book your treatment. So if you have glaucoma, if it's an eyeliner, 5 weeks pre or post chemotherapy, the immunity system extremely low, so we're not advising to apply any semi-permanent makeup before that. Local anesthetics. There is a new rule. We're not allowed to apply local anesthetics. It should be your choice. You should buy Amla cream in any pharmacy and apply it 40 minutes prior procedure if you want your eyebrows numb. I would recommend a little patch test before applying on your eyebrows to see if you will be having reactions to that. So, and yeah, if you have any questions, please pop in.